Now we are going to start the PYQs and one-liners for your FMGE that will help you for surgery portion in exam. Let's start. A 45-year-old with abdominal pain, vomiting, and absolute constipation. On examination, there is a tender mass in the right iliac fossa. What is the most likely diagnosis? A. Acute appendicitis. B. Sigmoid volvulus. C. Intussusception. Mesenteric ischemia. Because the symptoms of acute abdominal pain, vomiting, and absolute constipation with a tender mass in the right iliac fossa suggest acute appendicitis, often presenting with a palpable mass in complicated cases, e.g. appendicular mass. Sigmoid volvulus typically causes left-sided symptoms, and intussusception is more common in children, and mesenteric ischemia presents with severe pain out of proportion to examination findings. So, answer will be acute appendicitis. What is the most common site of intestinal obstruction due to gallstone ileus? A. Duodenum. B. Jejunum. C. Ileum. Sigmoid colon. Because gallstone ileus occurs when a gallstone passes through a cholecystoenteric fistula and obstructs the intestine, most commonly at the ileum due to its narrower lumen. So, answer will be ileum. Let's move on. A patient with a history of disease presents with sudden severe epigastric pain and a rigid abdomen. X-ray shows free air under the diaphragm. What is the diagnosis? A. Acute pancreatitis. B. Perforated peptic ulcer. C. Acute cholecystitis. D. Ruptured aortic aneurysm. Because sudden severe epigastric pain with a rigid abdomen and free air under the diaphragm, pneumoperitoneum on X-ray is classic for a perforated peptic ulcer, often requiring urgent surgical intervention. So, answer will be perforated peptic ulcer. What is the most of acute mesenteric ischemia? A. Arterial embolism. B. Venous thrombosis. C. Non-occlusive ischemia. D. Arterial thrombosis. Because arterial embolism, often from a cardiac source, e.g. atrial fibrillation, is the most common cause of acute mesenteric ischemia, leading to sudden severe abdominal pain. So, answer will be arterial embolism. A 60-year-old male presents with painless jaundice and weight loss. Ultrasound shows a dilated common bile duct and a mass in the pancreas. What is the most likely diagnosis? Chronic pancreatitis. B. Pancreatic carcinoma. C. cholangiocarcinoma. D. Gallbladder carcinoma. Because painless jaundice, weight loss, and a pancreatic mass with dilated bile ducts suggest pancreatic carcinoma, typically located in the head of the pancreas, causing obstructive jaundice. So, answer will be pancreatic carcinoma. What is the surgical procedure of choice for a perforated duodenal ulcer? A. Vagotomy. B. Grams-omental patch repair. C. Gastrectomy. D. Pancreatoplasty. Because Grams-omental patch repair is the standard surgical procedure for closing a perforated duodenal ulcer, providing a simple and effective seal. So, answer will be Grams-omental patch repair. A 30-year-old male presents with a pulsatile abdominal mass and hypotension. What is the next step in management? A. CT scan abdomen. B. Immediate laparotomy. C. Ultrasound abdomen. D. Observation. Because a pulsatile abdominal mass with hypotension suggests a ruptured abdominal aortic aneurysm, a surgical emergency requiring immediate laparotomy to prevent exsanguination. So, answer will be immediate laparotomy. What is the most common type of hernia in males? Femoral hernia. B. Direct inguinal hernia. C. Indirect inguinal hernia. D. Umbilical hernia. Because indirect inguinal hernia is the most common type in males, passing through the internal inguinal ring along the spermatic cord. So, answer will be indirect inguinal hernia. Let's move on. A patient presents with a swelling in the groin that reduces on lying down. Cough impulse is positive. What is the diagnosis? A. Femoral hernia. B. Inguinal hernia. C. Hydrocele. D. Varicocele. Because a reducible groin swelling with a positive cough impulse is characteristic of an inguinal hernia, distinguishing it from other conditions like hydrocelia or varicocele. So, answer will be inguinal hernia. What is the most common complication of acute appendicitis? Perforation. B. Abscess formation. C. Sepsis. D. Bowel obstruction. Because perforation is the most common complication of untreated acute appendicitis, leading to peritonitis or abscess formation. So, answer will be perforation. Let's move on. What is the hallmark sign of acute appendicitis on physical examination? A. Murphy's sign. B. Rovsing's sign. C. Soy's sign. Obturator sign. Because Rovsing's sign. Pain in the right iliac fossa and palpation of the left iliac fossa is a hallmark of acute appendicitis, indicating peritoneal irritation. So, answer will be Rovsing's sign. A patient with a history of gallstones presents with right upper quadrant pain, fever, and jaundice. What is the most likely diagnosis? Hepatitis. Because the triad of right upper quadrant pain, fever, and jaundice, Charcot's triad, is characteristic of acute cholangitis, often due to bile duct obstruction by gallstones. So, answer will be acute cholangitis. What is the investigation of choice for diagnosing acute cholecystitis? ERCP. Because ultrasound is the initial investigation of choice for acute cholecystitis, showing gallstones, gallbladder wall thickening, and pericholecystic fluid. So, answer will be ultrasound abdomen. A 50-year-old male presents with hematemesis and a history of chronic alcohol use. What is the most likely cause? A. Peptic ulcer disease. B. Esophageal varices. C. Mallory-Weiss tear. D. Gastric carcinoma. Because esophageal varices are the most likely cause of hematemesis in a patient with chronic alcohol use, often due to portal hypertension from liver cirrhosis. So, answer will be esophageal varices. Small intestine. Because Sigmoid colon is the most common site of volvulus in adults, often presenting with abdominal distension and constipation. What is the most likely cause? A. Adhesions. B. Hernia. C. Tumor. D. Volvulus. Because adhesions are the most common cause of small bowel obstruction in patients with a history of abdominal surgery, such as appendectomy. So, answer will be adhesions. What is the most sensitive test for detecting gallstones? MRI abdomen. Because ultrasound is the most sensitive and specific test for detecting gallstones, visualizing stones and associated complications like cholecystitis. Biopsy shows invasive ductal carcinoma. What is the most common type of breast cancer? Medullary carcinoma. Because invasive ductal carcinoma is the most common type of breast cancer, accounting for approximately 80% of cases. Lumpectomy with radiotherapy. C. Chemotherapy. D. Hormonal therapy. Because lumpectomy followed by radiotherapy is the preferred treatment for early-stage breast cancer, stage I or TOI, offering equivalent survival to mastectomy. So, answer will be lumpectomy with radiotherapy. 20. A patient presents with a neck mass that moves with swallowing. What is the most likely diagnosis? Lipoma. Because the neck mass that moves with swallowing is characteristic of a thyroid nodule, as the thyroid gland is attached to the trachea. So, answer will be thyroid nodule. Let's talk about orthopedics. A 25-year-old male presents with a fall on an outstretched hand and wrist pain. X-ray shows a fracture of the distal radius with dorsal displacement. What is the diagnosis? Boxer's fracture. Because Colles fracture is a distal radius fracture with dorsal displacement, commonly caused by a fall on an outstretched hand. Proximal pole. B. Waist. C. Distal pole. D. Tubercle. Because the waist of the scaphoid is the most common site of fracture, often associated with a fall on an outstretched hand. So, answer will be waist. A 60-year-old female presents with hip pain and inability to bear weight after a fall. X-ray shows a fracture of the femoral neck. What is the treatment of choice? Conservative management. Because hemiarthroplasty is the treatment of choice for displaced femoral neck fractures in elderly patients, restoring mobility and function. So, answer will be hemiarthroplasty. What is the most common cause of compartment syndrome in the leg? Tibial fracture. B. Soft tissue injury. C. Arterial occlusion. D. Venous thrombosis. Because tibial fracture is the most common cause of compartment syndrome in the leg, leading to increased intercompartmental pressure. So, answer will be tibial fracture. A 30-year-old male presents with knee pain and locking after a twisting injury. MRI shows a tear in the medial meniscus. What is the treatment? A. Arthroscopic meniscectomy. B. Total knee replacement. C. Conservative management. D. Ligament reconstruction. Because Arthroscopic meniscectomy is the treatment of choice for symptomatic medial meniscus tears causing locking or pain. Anterior, C. Inferior, D. Superior. Because anterior shoulder dislocation is the most common, often caused by trauma or a fall on an outstretched arm. So, answer will be anterior. A patient presents with a deformity of the spine and a hump on the back. What is the most likely diagnosis? A. Scoliosis, B. Kyphosis, C. Lordosis, D. Ankylosing spondylitis. So, answer will be kyphosis. Claw hand. Because the fat pad sign on X-ray is a hallmark of supracondylar fracture, indicating joint diffusion or hemarthrosis. What is the diagnosis? A. Osteoarthritis, B. Rheumatoid arthritis, C. Ankylosing spondylitis, D. Gout. Because bamboo spine on X-ray is characteristic of ankylosing spondylitis, a seronegative spondylarthropathy, causing sacroiliac joint fusion and spinal stiffness. So, answer will be ankylosing spondylitis. What is the most common organism causing septic arthritis? Escherichia coli. Because Staphylococcus aureus is the most common cause of septic arthritis in adults and children, leading to painful swollen joints. So, answer will be Staphylococcus aureus. Laryngeal carcinoma, C. Laryngitis, D. Vocal cord nodule. Because hoarseness for over 3 weeks in a smoker with a vocal cord lesion is highly suggestive of laryngeal carcinoma, requiring urgent biopsy. So, answer will be laryngeal carcinoma. Bleeding disorder, osteoarthritis. Because a red bulging tympanic membrane with ear pain and hearing loss is characteristic of acute otitis media, often bacterial in origin. Staphylococcus aureus, C. Pseudomonas aeruginosa, D. Moraxella catarrhalis. Because Streptococcus pneumonia is the most common cause of acute otitis media, followed by Haemophilus influenza and Moraxella catarrhalis. So, answer will be Streptococcus pneumonia. A patient presents with unilateral nasal obstruction and foul-smelling discharge. Nasal endoscopy shows a mass. What is the most likely diagnosis? Inverted papilloma. Because unilateral nasal obstruction with foul-smelling discharge and a mass suggests a nasal foreign body, especially in children, or possibly rhinosporidiasis in endemic areas. So, answer will be foreign body. Steroid. Because incision and drainage is the treatment of choice for a peritonsillar abscess, relieving symptoms and preventing complications. MRI shows a cerebellopontine angle tumor. What is the most likely diagnosis? Metastasis. Because unilateral hearing loss and tinnitus with a cerebellopontine angle tumor on MRI are characteristic of acoustic neuroma, vestibular schwannoma. So, answer will be acoustic neuroma. What is the most common site of origin for nasopharyngeal carcinoma? Fossa of Rosenmiller. B. Nasal septum. C. Turbinates. D. Soft palate. Because the fossa of Rosenmiller is the most common site of origin for nasopharyngeal carcinoma, often associated with Epstein-Barr virus. So, answer will be fossa of Rosenmiller. Let's move on. A patient presents with severe vertigo, nausea and hearing loss. What is the most likely diagnosis? Labyrinthitis. So, answer will be Meniere's disease. What is the most common complication of untreated chronic suppurative otitis media? Facial nerve palsy. Because mastoiditis is the most common complication of untreated chronic suppurative otitis media, resulting from infection spreading to the mastoid air cell. So, answer will be mastoiditis. Let's talk about age-related macular degeneration. D. Diabetic retinopathy. Because gradual vision loss with central scotoma and fundoscopic findings of drusen and pigmentary changes are characteristic of age-related macular degeneration. So, answer will be age-related macular degeneration. Teratoma. Because cataract is the leading cause of blindness globally, particularly in developing countries, due to its high prevalence and treatability. So, answer will be cataract. A patient presents with sudden painless vision loss in one eye. Fundoscopy shows a cherry red spot on the macula. What is the diagnosis? Vitreous hemorrhage. Because sudden painless vision loss with a cherry red spot on the macula is classic for central retinal artery occlusion and ocular emergence. Topical beta blockers. B. Laser trabeculoplasty. C. Trabeculectomy. So, answer will be topical beta blockers. Let's move on. A patient presents with a painful red eye and blurred vision. Slit lamp examination shows cells in the anterior chamber. What is the diagnosis? A. Conjunctivitis. B. Anterior uveitis. C. Acute angle closure glaucoma.
D. Corneal ulcer. Because a painful red eye with cells in the anterior chamber on slit lamp examination is diagnostic of anterior uveitis, often associated with systemic disease. So, answer will be anterior uveitis. What is the most common organism causing bacterial keratitis in contact lens users? Haemophilus influenza. Fundoscopy shows a retinal tear. What is the most likely complication if untreated? A retinal detachment. B. Macular degeneration. So, answer will be retinal detachment. Let's move on. What is the most common type of cataract? A nuclear cataract. D. Cortical cataract. C. Posterior subcapsular cataract. D. Congenital cataract. Because nuclear cataract, associated with aging, is the most common type, causing central lens opacification and vision loss. So, answer will be nuclear cataract. A patient presents with halos around lights, severe eye pain and nausea. What is the most likely diagnosis? Acute angle closure glaucoma. B. Anterior uveitis. C. Corneal ulcer. D. Conjunctivitis. Because halos around lights, severe eye pain and nausea are classic symptoms of acute angle closure glaucoma, a medical emergency. So, answer will be acute angle closure glaucoma. Let's move on. What is the investigation of choice for diagnosing glaucoma? Tonometry. B. Fundoscopy. C. Visual field testing. D. Optical coherence tomography. Because tonometry, which measures intraocular pressure, is the primary investigation for diagnosing glaucoma, often supplemented by other tests like visual field testing.
What is the most common cause of small bowel obstruction in adults? Answer is adhesions, because adhesions from previous surgeries are the leading cause of small bowel obstruction in adults. What is the triad of symptoms in acute cholangitis? Answer is fever, jaundice, quadrant pain, Charcot's triad, because Charcot's triad is diagnostic for acute cholangitis. Let's move on. What is the most common type of thyroid cancer? Answer is papillary carcinoma, because papillary carcinoma is the most common with a good prognosis and characteristic psammoma bodies. What is the most common site of metastasis for breast cancer? Answer is bone, because breast cancer most commonly metastasizes to bones, followed by lungs and liver. What is the surgical treatment for acute cholecystitis? Answer is because preferably laparoscopy is the definitive treatment for itis. What is the lower gastrointestinal bleeding in adults? Answer is diverticulosis, because diverticulosis is painless lower GI bleeding in adults. What is the hallmark sign of acute pancreatitis? Answer is epigastric pain radiating to the back, because this pain pattern is characteristic of acute pancreatitis, often associated with elevated amylase lipase. Okay, what is the most common organism causing wound infections post-surgery? Answer is Staphylococcus aureus, because Staphylococcus aureus is the most common cause of surgical site infections. What is the treatment for a strangulated inguinal hernia? Answer is emergency surgery, because a strangulated hernia is a surgical emergency due to the risk of bowel ischemia. What is the most common type of esophageal cancer in smokers? Answer is squamous cell carcinoma. The explanation squamous cell carcinoma is associated with smoking and alcohol, unlike adenocarcinoma. Let's move on. What is the most common cause of hydronephrosis in adults? Answer is ureteric stones, because ureteric stones are the most common cause of hydronephrosis, leading to urinary obstruction. What is treatment for a perforated? Answer is appendectomy. Definitive treatment appendix, often with peritoneal lavage. Okay, let's move on. What is the most common site of ectopic thyroid tissue? Answer is lingual, because the tongue base is the most common site for ectopic thyroid tissue. What is the most common type of gallstone? Answer is cholesterol gallstone, because cholesterol gallstones are the most common, often associated with obesity and female gender. Let's move on. Okay, what is the most common cause of acute arterial occlusion in the lower limb? Answer is embolism, because embolism, often source, is the leading cause of acute limb ischemia. What is the investigation of choice for suspected renal artery stenosis? Answer is CT angiography, because CT angiography is highly sensitive for visualizing renal artery stenosis. Answer is bleeding, because bleeding is the most common complication, presenting as hematemesis or melena. What is the surgical treatment for chronic pancreatitis with ductal obstruction? Answer is pancreatic duodenectomy, Whipple's procedure, because Whipple is used for chronic pancreatitis with ductal obstruction or suspected malignancy. Let's move on. What is the most common type of salivary gland tumor? Answer is pleomorphic adenoma, because pleomorphic adenoma is the most common benign tumor of the salivary glands, usually in the parotid. What is the most common cause of secondary peritonitis? Appendix. Peptic ulcer is the leading cause of secondary peritonitis. What is the most common type of fracture in children? Okay, let's move on. What is the most common cause of osteomyelitis in adults? Answer is Staphylococcus aureus, because Staphylococcus aureus is the most common causative organism in osteomyelitis. Answer is surgical fixation, because displaced clavicle fractures often require surgical fixation to ensure proper alignment and healing. What is the most common site of stress fractures in athletes? Answer is tibia, because the tibia is the most common site due to repetitive stress from running or jumping. Let's move on. Okay, what is the most common cause of anterior knee pain in adolescents? Answer is patellofemoral pain syndrome, because this is common in adolescence due to overuse or maltracking of the patella. What is the most common type of hip dislocation? Answer is posterior, because posterior hip dislocation is most common, often caused by high-energy trauma like motor vehicle accidents. Let's move on. What is the treatment for a torn anterior cruciate ligament ACL? Answer is ACL reconstruction, because surgical reconstruction is the treatment of choice for active patients with ACL tears. Answer is trauma, because trauma, such as motor vehicle accidents or falls, is the leading cause of spinal cord injury. What is the most common type of bone tumor? Answer is osteosarcoma, because osteosarcoma is the most common primary malignant bone tumor, typically affecting young adults. Let's move on. What is the hallmark sign of a femoral shaft fracture? Answer is thigh deformity and shortening, because femoral shaft fractures cause significant deformity and limb shortening due to muscle pull. What is the most common cause of hearing loss in adults? Answer is presbycusis, because presbycusis, age-related hearing loss, is the most common cause in adults. What is the treatment for severe epistaxis not controlled by PAC? Answer is endoscopic cauterization, because endoscopic cauterization targets bleeding vessels in refractory epistaxis cases. What is the most common site of sinusitis? Answer is maxillary sinus, because the maxillary sinus is the most commonly affected due to its dependent drainage. Let's move on. Okay, what is the most common cause of facial nerve palsy? Answer is Bell's palsy, because Bell's palsy is an idiopathic condition causing unilateral facial nerve paralysis. Answer is observation, because most perforated tympanic membranes heal spontaneously. Surgery is rarely needed. What is the most common type of laryngeal cancer? Okay, let's move on. What is the most common cause of streighter in children? Answer is croup, because croup, caused by viral infection, is the most common cause of streighter in children. What is the treatment for a nasal fracture? Answer is closed reduction, because closed reduction is the standard treatment for uncomplicated nasal fractures. Answer is conductive hearing loss, because chronic suppurative otitis media causes conductive hearing loss due to ossicular chain damage. Let's move on. What is the most common cause of vertigo in adults? Answer is benign paroxysmal positional vertigo, BPPV. Answer is viral conjunctivitis, because viral conjunctivitis, often caused by adenovirus, is the most common type. What is the treatment for a corneal ulcer? Answer is topical antibiotics, because topical antibiotics are the mainstay of treatment to prevent corneal perforation. Let's move on. What is the most common cause of proptosis in adults? Answer is thyroid eye disease, because thyroid eye disease, Graves' ophthalmopathy, is the leading cause of proptosis in adults. What is the hallmark sign of diabetic retinopathy? Answer is microaneurysms, because microaneurysms are the earliest fundoscopic finding in diabetic retinopathy. What is the treatment for a retinal detachment? Answer is surgical repair, scleral buckling, or vitrectomy, because surgical intervention is required to reattach the retina and prevent vision loss. Okay, let's move on. What is the most common cause of sudden bilateral vision loss? Answer is bilateral occipital lobe infarction, because this is often due to stroke affecting the visual cortex. What is the most common type of eyelid tumor? Answer is basal cell carcinoma, because basal cell carcinoma is the most common eyelid malignancy, often on the lower lid. What is the treatment for chemical burns to the eye? Answer is copious irrigation, because immediate irrigation with saline or water is critical to minimize corneal damage. Let's move on. What is the most common cause of red eye in adults? Answer is conjunctivitis,
Because conjunctivitis, viral, bacterial, or allergic, is the most common cause of red eye. What is the investigation of choice for orbital cellulitis? Answer is CT scan, because CT scan is used to assess for abscess or sinus involvement in orbital cellulitis. That's all for today.